Hello guys and welcome back to a new video of DocTalks India. I am Dr. Anada Prashanna Panda, and in today's video we are going to discuss about bleeding per rectum. So bleeding per rectum means there will be bleeding through the anal canal or anal opening. So it's a very important topic in surgery, and today we are going to simplify it for you so that you don't have any problem in understanding this topic. So, bleeding per rectum, think like that. If the bleeding is there and it's coming out from rectum, then where is the most probable pathology? It must be in GIT, right? So, in GIT, we can divide it into upper GI and lower GI. The question is how to mark the perfect point, that is from this point onwards, this is lower GI, and this point onward, it's upper GI. So it's your task to get the answer and comment down in the comment section. Subtle hints that it's a ligament which connects in the duodenum. Okay, so it's just a hint for you guys. And let us move on. Starting from the lower GI bleeding, we can again divide the lower GI into three parts: bleeding from rectum and anal canal, bleeding from cecum, and bleeding from the small intestine. So starting from the bleeding from rectum and anal canal, what do you think what the causes can be? So there it's rectum, right? In rectum there can be first cancer. Like I am saying this, but it's not the most common type, but I am just telling because cancer it's very common, right? Not in case of bleeding per rectum, but yes, it's a cause. Again, hemorrhoids. Second is hemorrhoid, and third one is anal fissures. Then ulcerative colitis in cecum. Okay, though it's very less common, but still it can affect. So these are the four most common causes which can cause bleeding per rectum, but still there are some other causes like perianal hematoma, the rupture of which can lead to per rectal bleeding. Then coming to causes which are present in cecum. So in cecum there can be ulcerative colitis or Crohn's disease. Then after that there can be amoebic liver abscess. It was amoebic ulcer. Okay. Then diverticular disease can be there, or any kind of bacillary dysentery can also be there, and ischemic disease is like ischemic colitis. Okay. And after that we can move into small intestine. In small intestine, most common causes into susception, and the second one is diverticulitis. Okay, so intussusception and diverticulitis, these both are pediatric conditions. I am not saying that it can't occur in aged male or female. It can be seen, but mostly or maximum time it's in pediatric age group. So we will discuss about that in the further discussion. Then after that, general causes like upper GI bleeding. If there is any kind of upper GI bleeding like Bore Harbor syndrome, if you know, then there is a syndrome called Bore Harbor syndrome. Then like esophageal rupture, then perforation, GI perforation, peptic ulcer perforation I am saying about. Then after that, general condition like if any coagulopathy or elliptic cavity is deranged due to the derangement of liver and kidney functions, so that can also lead to bleeding per rectum. but these are less common. we are talking about more common causes in the lower GI tract. Then the question arises how to differentiate between the lower GI and the upper GI tract, the tract bleedings. Okay, so I will tell you a trick. It's the color. If the color is tarry, then and blackish color, then it is definitely upper GI bleeding. If the bleeding is fresh, then it is lower GI bleeding. You may ask why. So the answer is, when there is upper GI bleeding, there is bleeding in the upper GI, then there is more chances that blood will come to our stomach and there is acid secretion. So that acid secretion, the acid will react with the blood and it will form a pigment. So this pigment color is blackish in color. Then throughout the GI, when it is moving, and then it will become blackish in color. But if you like see the distance of rectum and anal canal and cecum, it is way more less, and after that it is not getting exposed to the acidic material, so the bleeding will be fresh. So that's how you are going to differentiate between upper GI and lower GI bleeding. Okay, so let us see like what is the patient is giving in history. First, coming to age, what do you think, like in pediatric age group, what will be the most common cause of lower GI bleeding? Do you think it will be cancer? No, absolutely not. So what will be the cause? Yes, congenital deformity. If there is congenital deformities, then it will definitely give rise to rectal bleeding. So I have already mentioned two of them. Those are intussusception and diverticulum. So yeah, and in middle-aged like peoples, what will be the most common cause of rectal bleeding? Okay, so two most common rectal bleeding causes in middle-aged male and females are hemorrhoids and anal fissures. Then coming to the older age group, like people falling under the older age group. So what do you think the common causes? Yes, the common causes are cancer, CA cecum or CA rectum. So these can lead to rectal bleeding. Then in history we can see the onset, whether it is acute or it is chronic in nature. What do you think that can the condition which can give to acute bleeding? The acute bleeding can be seen in mesenteric colitis, angiodysplasia of colon, ischemic colitis, Meckel's diverticulum, and Meckel's diverticulum also in intussusception. Then acute, yes, that acute episode of ulcerative colitis. So these are the conditions in which we can see acute GI bleeding, like acute bleeding per rectum. But and except these conditions, in all other conditions we are going to see chronic, like the bleeding will be chronic in nature. Okay, after that the amount of blood loss, like whether it is very large in amount or it's very less. So that's also an important history which we can take. Then relation to the relation of the bleeding to the defecation, whether it is occurring before the defecation, after defecation, or along with defecation. Like in hemorrhoids, what happens when the patient give pressure, then the hemorrhoids comes out before the stool passing through the like anal canal, and this will lead to the rupture of that will lead to the rupture of the what to say, that hemorrhoids. Then that like just after passing out the stool, the hemorrhoid will rupture. Then it will, like, the bleeding will be per rectal. But in case of anal fissure, the bleeding will occur before the defecation, like just before the defecation the bleeding is going to occur. Then coming to the, so there are also conditions which are associated with stools, like which are not associated with passing of stool, like they can occur in any time, like in case of carcinoma, then ulcerative colitis like IBDs. So these and angiodysplasia of colon, so these conditions can give rise to bleeding, and they don't have any relationship with the passing of stool. After that, coming to the individual characteristic of the blood which is coming per rectum, like if the bleeding is fresh and the patient says that it like comes like a splash after the stools come out and it splash out in the pan, then most probably it is due to ruptured hemorrhoids. Then recurrent jelly like stool, recurrent jelly stools. So this is seen mainly in pediatric age group, as I have already mentioned. So this is a characteristic feature of intussusception. Okay, and after that there can be melena. Melena, I have already told you that when upper GI bleeding occurs, then due to the reaction of blood with the acid, that will convert it into black tarry substances. So that will that is called as melena. And after that, if there is Meckel diverticulum, that will give to a maroon colored stool. So these are the some specific characteristic about the the nature of bleeding per rectum. Okay, then whether it is associated with pain or not. So all the pathologies that are present below the Hilton's line, like anal fissure and also in hemorrhoids. So these will give rise to painful, like these are painful condition. If any pathology that is coming up above from the Hilton's line, then there will be those conditions will be not associated with pain. Then what all are the examinations you are going to perform? So general examination, we have to start with the general vitals and all we have to see. Then in general sign and symptom, we have to see pallor, icterus, jaundice, clubbing. So from this point of view, the most important point is pallor. If there is severe bleeding, then there will be a pallor present, and you can also grading and know how much hemoglobin is present in the patient. So those of you, I think every one of you may be knowing this, but if anybody don't know, then we see pallor right here at this place in the lower palpebral conjunctiva. We see palpebral and yes, we see the pallor, and pallor means there will be paleness, whitish color, like it will become more whitish color. So that is a marker of anemia. Significant blood loss is there, and patient is anemic and needs immediate intervention. Okay, in acute bleeding, like the pallor develops lately, even though significant bleeding has been already occurred. But in chronic bleeding, you will able to notice pallor, like simply in the clinic. Then after that, in the palpation and all, you can palpate any lump in the left or right, like sorry, like you will be able to palpate if there is any lump in the left or right iliac fossa. If there is a cylindrical mass which is movable from side to side, then it can be in a case of intussusception. If there is mass, then that can be CA colon. Okay, so after that palpation, then what point we are missing, then digital, okay, then we should move on to our the normal clinical examination. Like clinical examination is already done, so we will be moving into the laboratory investigation. Then per rectal examination is there, then digital, that is called digital rectal examination. Now digital doesn't mean that you are going to do it digitally, you are going to do digitally, that means with the help of finger. And proctoscopy, we can do that. Then we can do a barium enema to detect if there is any pathology in the lower GI tract. So basically what we do, we give barium enema through from the lower GI from anal canal, the opening of the anal canal, then it will move upwards, and after that we will be taking subsequent images, and that will show us like in case of CA colon, we can see that apple, what to say, there will be it will show like somebody has eaten the apple, and the middle part is only it's what it is called, like I am not getting the proper word, bitten apple appearance, I think. So you can cross check that. So after that, what other investigation we can do is colonoscopy, then endoscopy, and after that we will be able to get to the pathology. We will be able to get to the pathology, and we can start intervention depending upon what are the cause of poor rectal bleeding. So yeah, this is a very important topic. I thought I should be mentioning each and every aspect of that video. It's this is my initial videos, so there are many fault you may be noticing, but yeah, I will try to subsequently decrease the faults, and I will try to make good quality videos for you guys. Thank you so much for your support. Please subscribe to our YouTube channel and follow me on Instagram, where I share my notes and clinical snippets, as well as we always discuss on ECG, X-ray, instruments and other clinical knowledge. So yeah, this was all about the video. Thank you so much for your support. We'll see each other in the next video, in the upcoming video. Thank you so much.